Yeah, so it's definitely not a one size fits all. I wish it was. Sometimes it would make things a lot easier. If everybody say, hey, take one pill, you're all better. But it's nothing like that. If we were to, keep in mind that most of cancer, the diagnosis is largely based on geography, meaning where is the cancer located in the human body. The challenge with that strategy is that we've learned so much through current science that we know no matter where the cancer is located, that might be the geography, hey, it's a bladder cancer, but it may have genetic aspects that mimic that of a lung cancer or a brain cancer. And the way that drugs are approved, they're approved for claims for a given cancer, which is based on the geography. So there's some challenges with helping people get the right treatment for the right cancer. But generally speaking, you would divide bladder cancers into three categories, if you will. So one would be transitional cancer or transitional cell carcinoma. These would be cancer cells that start in the innermost layers of the bladder. So think of it as a smooth muscle that makes up the outside of the bladder, and there's layers in that muscular tissue, and there could be cells throughout those layers. Those particular cancer cells are in the area of the body that when the bladder expands or shrinks, the cells can stretch a little bit. So they can, almost like your muscle cells can get longer or shorter as you contract a muscle. You could think of those particular cells in the bladder, they could also move, which are expand in length and shape. And the significance of that is that those types of cells is where you see a lot of the transitional types of cancers. So that's a more common one. So that transitional will be one category. You then have a squamous cell carcinoma, which is a second category. And a squamous cell just refers to the shape and size of the cells that become cancerous. So generally speaking, squamous cells are thin, flat cells, and they typically are formed in the bladder after a long-term infection. Then you have also an adenocarcinoma. This is a cancer that begins in the glandular cells. So generally speaking, you think of a gland as a tissue that produces a substance that gets secreted into the blood. Typically, those substances are hormones. And so an adenocarcinoma bladder cancer is a little bit more rare. And one of the ways you can know, there's different pathology tests to see the types of these cancers. And then there's a last one, or a fourth category, if you will, called the superficial bladder cancer. And this is when the cancer spread through the lining of the bladder as opposed to inside of the muscles. Now, when we talked earlier, when I first started talking about the transitional cell carcinoma located in sort of in the muscle, or the innermost layers of the bladder, there's a couple of categories within that. So you have a low-grade transitional cell carcinoma, and you have a high-grade transitional cell carcinoma. The low-grade doesn't usually spread, and the high-grade usually does spread. So as you can imagine, from hearing that, it's not just so simple like bladder cancer. We all got the same bladder cancer. In other words, if people have that same diagnosis, even at a very superficial level, you have different categories. But then beyond those categories, you could do all kinds of genetic tests that further delineate the differences between all those cancers. Most of the time, the way that information is interpreted is if you have a certain gene in that given cancer, there may be a drug that has already been discovered that may be a good tool to treat the genetic attributes of that cancer. One of the challenges with that approach, though, is that some of those cancer cells mutate and change, so that single therapy may work at the beginning, but it does not work forever. So at some point, those cancer cells develop resistance mechanisms, or they change, and that initial drug that was used no longer works. And so that is why the recurrence rate, or it's a contributing factor, why people may get a bladder cancer again. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? In traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now, I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.